Y'all, I have had it with the US health insurance system. I don't have insurance. You read that title right. In fact, I found out just a couple hours ago that I don't have insurance. But it's not my fault. And I'm gonna take you through the entire situation that's gone on for maybe 6 weeks now of me going from having insurance, not having insurance, having insurance, not having it. It has been a journey. And I'm taking you on it because I need to lay out everything that is wrong with this system that I have found and everything I have learned to hopefully help you in some ways choose an insurance if you're in the United States, because it is not easy. Having diabetes sucks, but I think the US health insurance system sucks more. Yeah, it does, although diabetes kind of sucks. But I'm going to get into my story, how I lost coverage, how I got it, then lost it, then I got it, then lost it. The lack of transparency when it comes to pricing. You can't just call someone and say, how much is this drug? It's not that simple. In fact, I found that health insurance in America is kind of like a car dealership. I've learned that there are too many middlemen and people in this. The fact that I'm going from 5 departments to get to the person who can answer the question after asking the question multiple times. No one knows who has the answer, and sometimes there is no answer. I've also learned a ton of new terms and things to look out for, whether or not you even have diabetes. And health insurance completely differs from state to state. Prices and all that jazz, I'm gonna get into that too. But I wanna hear your health insurance horror stories in the comments. I'm sure there are some even worse than mine. I want this to build up. I want to use this as a way to compile everything and then present it in some way, and I'll get into that later. But I think that we need to kind of crowdsource all of our issues with the system in one place. Let's do it here.
I also just brought an expert on the podcast to talk about all of the problems with the US health industry. We get into why health insurance companies are seeing record profits and consumers are still struggling. We also talk about the future of AI in healthcare. You can watch that episode with the link in the description.
This video is not medical advice, it's for educational purposes only. It is my experience in this entire system, what I've done, and I'm not that good at it. I'm gonna lay out everything I've done. Before I go any further, I'm Justin. I have type 1 diabetes, and on here I talk all things diabetes tech, news, and management. I talk to industry leaders on my podcast on Mondays and also people who use the technology. And then on Fridays, I do these videos about technology and my experience using it. And I'm usually very positive. I mean, I even think I'm probably gonna still be positive, but I'm angry about the whole thing that's going on right now, and I'm putting it down on the interwebs. So I apologize, I'm not gonna be so happy today. Let's start from the very beginning. Very good place to start. I had health insurance through my job. Lost that job about 20 months ago. And we have this thing called COBRA in the US, where if you lose your job, you get to keep that health insurance. You have to pay for it out of your own pocket. You can keep it up to 18 months. I took the full 18 months because the insurance price really wasn't that bad, and it was great insurance. Especially when you're looking at things now like, whoa, I had it good. So that insurance was coming up and I needed to get new health insurance. This was in September. It was gonna expire the end of September. October 1st, I needed new insurance. So I did what anyone would do, or I guess some people do it on their own. I found an insurance broker because I wanted someone to help guide me through this. I have diabetes. These are the drugs I take. These are the 2 doctors I have. Can you help me find a plan that works best? Let's roll that tape of me explaining that story on social. In early September, I decided to reach out to a health insurance broker who could help me find a new health insurance. And I said to her that I just have 2 doctors I need to make sure that I can see, and these are the 3 medications I use. They got back to me with some options. I looked through them. They said that all of these plans should have reasonable prices and to choose one. So my old health insurance ran out and I got the new one. I contacted my endocrinologist and said, hey, I am going to need medication coming up. Here's my new insurance. Can you help me out? They get back to me and they say, we don't take your health insurance. Panicked,
But I was like, all right, let me at least get the medication. The office said that they would do prior authorizations to help me get the medication. They sent those to the new health insurance. Very nice of them. The new health insurance gets back to me and they say, hey, we got your prior authorizations. You're good to go. And they were like, hey, we just want to make sure, we want to go over these prices. And they told me that my Omnipods would cost me over $2,000 for a 3-month supply, and that my Dexcom G7s would cost me $1,055 for a 3-month supply. What? I thought I did everything right. I asked the insurance broker to find me an insurance based off of these medications I take and these 2 doctors I see, and they didn't. And I only have 20 days left of Omnipods. So I am currently on a quest to find new health insurance. I was told not to get it on the marketplace. Anyway, this is all to say that our system is so convoluted. Yeah, this is not an exciting moment.
So yeah, my insurance broker dropped the ball. Didn't give me an insurance plan that was covered by my one of 2 doctors I offered, and my drugs were completely inflated prices. Part of the reason for that I found was that there was a deductible, a drug deductible, meaning that in the 3 months that I had this health insurance, I needed to meet $2,100 just for them to start paying for my drugs other than my copayment. I didn't realize that when I did it, and I spoke to the broker and said these are the things I needed, and they kind of dropped the ball on that. Anyway, I have this health insurance. I'm working hard to see if I can get a new health insurance, calling a ton of times to see, like, can I upgrade this to a different one that doesn't have this drug deductible? In the meantime, trying to use the insurance I have, I had like a sore throat and I was like, you know what? I want to go to the doctor. I've been staying in Palm Springs for the last 6 weeks. Let me go see someone. And I go on the website for Anthem and I look up doctors and nothing comes up for this zip code. So I'm like, all right, let me call them. It must be a mistake. And they said there are no doctors or urgent cares that are covered in your area. You'll need to go to the emergency room for a sore throat. That was a big surprise. Why do I have this health insurance if it only covers me in one state? Isn't this the United States of America? Isn't this a country? The fact that I can't use my health insurance benefits that I'm paying for elsewhere really got on my nerves. I'm never this angry. I'm so sorry. I'm angry. So, sadly, I decided to not go to the doctor, see if it subsided. It did. I took a COVID test, wasn't that? And it just like goes to show that like there are probably a lot of people out there that just don't go to the doctor because it is too expensive. Their insurance doesn't cover it. It's a whole ridiculous thing. So what I wound up doing was I decided to cancel the health insurance I had. So I canceled that insurance, didn't get a new one, and then decided to actually get the older one in the meantime because I was going to be set for the last month of this year. So I called New York State and asked them if they could just reinstate the insurance. They said yes. I got an official letterhead on November 26th saying you have the health insurance now through the end of December. A few hours ago, I called up the pharmacy benefits of Anthem, my insurance company that I had, or thought I had, and they said, you don't have health insurance. You are uninsured as of December 1st. And that was news to me, especially since I have an official letterhead, I'll put it up on screen now, that says, Justin, you have health insurance through the end of the year. Starting November 26th, we have it. So I now need to call New York and figure that out. This was news to me. I was already writing this script and this happened today. It was funny how not funny it was. But yeah, I'm uninsured right now, but I do have proof that I should be insured. So if anything happens, I'm using that in court. Let's go through now all of the new terms that I've experienced, including that deductible, that drug deductible I experienced with my current plan that has $2,100 drug deductible. So basically, a drug deductible, or a deductible in general, is something you need to meet before insurance pays out. So no deductible is great if you are someone who's going to really be using your plan. There's no limit you have to meet before health insurance starts paying for things. This plan had a drug deductible, meaning I was going to have to pay $2,100 in drugs before they started paying part of it, and I would pay my copay of, $15, $55, whatever. So I'd have to pay full price for these drugs, $2,500. Well, it would get capped at $2,100 for Omnipod, etc. Right? So what I've learned is for someone with diabetes, don't get a plan with a drug deductible and don't get a plan with a combined deductible. There are plans that do that. So at least in the diabetes world, drug deductible, bad. Combined deductible, probably bad. Medical deductible, somewhat normal, but if you're someone who's really gonna need a lot of care, you probably want a low to no deductible. Out of pocket. So there's also an out of pocket max, which means that not only is there that deductible you need to meet, but then there's an out of pocket max. So you're still gonna accumulate charges from co-payments for doctors, for drugs, for lab tests, for surgeries, for scans, all that jazz. There's also an out-of-pocket max, which means you're not gonna pay any more than that. Your plan will take on full responsibility if you meet that. So I think the plan I have now is like $9,400, which I'm obviously not gonna do in 3 months, but the price you're paying a month is like a facade. It is like, this is the price, but like, by the way, there are all of these hidden prices, which aren't hidden, they're there. But like, do people get it? I mean, I've learned a lot over the last maybe 10 years of figuring out health insurances, but it still confuses me. I feel like I finally have a grasp, and that's why I'm making this video. But that's what out of pocket is. Yet another bracket that you have to meet for them to really pay. There's layers on layers here. So when you're looking at plans in the US, it's not just the deductible or the out of pocket. Then there's also like, how much are my primary care visits gonna cost? How much are my lab tests gonna cost every time? How much are my scans gonna cost every time? There's always going to be charges, even though you're paying a monthly fee. And then the worst part and the least transparency I'm finding is drugs. How much your drugs cost. Apparently no one's really having an easy time of telling me that, but I've been able to pull teeth and finally get there. So I've gone on 2 separate journeys of asking for drug prices. Let's start with New York, because I've done both New York and California, because I may move to California again. I was living in Los Angeles in the past. Anyway, in New York, I called the health insurance plan that I was going to have for 2025 and asked them, how much will my drugs cost in 2025? And I went from department to department to department, 5 departments at least. And by the time I got to the 5th department, after asking the same question every time, the person said, we can't give you a price for the insurance you'll have next year. You need to get it first. Where in the world, or what in the world do you have to get first before finding out the price? This is our health. This isn't a game. This isn't a car. This is health. And also the amount of stress that I should have been wearing this Oura ring the whole time during this and calculate it and show you the levels. It's outrageous. And so basically what I had the person do is I said, okay, let's just say I had the plan this year, or let's look at the plan for this year. What are the prices? And she was able to help me, which not everyone can do. Now, California. I've been looking at California insurances. In fact, I think I'm getting it because I think I'm gonna do a move to Los Angeles, where I lived for 8 years. I want some space. I wanna have a dedicated studio in Palm Springs now. So surprisingly, the plans in California are much more appealing than New York. They're not only better for the ones I'm looking at and comparing from New York to LA, like $450 less for about the same plan, but the plan in California is better. The one I found has no deductible. The pricing for the drugs is about the same, I think. Overall, it's pretty much the same, but I'm saving $450 a month, which is $6,000 a year. Huge difference. So the fact that every state is just different in what they're paying is just also another confusing thing. Everyone has a different situation and is getting better plans for less, like what? But then when it came to California, when I was looking at those plans, I asked for drug prices. And so I called, got some drug prices, wrote those down. Then I had someone amazing reach out, and they must be an expert in this situation. They actually wound up calling for me. And they got some drug prices, updated drug prices, that wound up being, some of them being the same and some of them being even less than what I was quoted by the same health insurer. Then I've been in touch with Insulet, the creators of Omnipod, and someone who works on their insurance. I sent them the plans and they sent me prices that were also different. What? How are 3 different people connected to the health insurance contacting or knowing what the prices are, and then everyone has different prices? Like, We should know how much our drug prices are when we are signing up for the plan. You should be able to put it in. There are drug formularies. So when you find the plan, in New York, it was all the way at the bottom. I had to scroll all the way to the bottom, click it. There was a formulary and I got this whole PDF with all the drugs. Not every drug's on there though. And some will say tier 1, tier 2, tier 3, and you can figure out those plan. Formularies also don't say how much the tier drugs are. So sometimes the PDFs will when you're signing up, but sometimes you have to call. Anyway, do you see what's happening? The amount of stress that is going on. Like, can we just pay a tax? I mean, this basically is a tax, right? Our health insurance in this country is a tax. The same way it would be in Europe for universal healthcare. They pay a tax, they get, their insurance or their care. We get it here as well, but there's just like varying degrees of what you can get. What I want to see is just more transparency, especially when it comes to people who need these medications. There should be a standardized way to plug in all of the medications you take and get that price. And then also, there's this whole thing in this country where you can either get a 1-month supply or a 3-month supply, and 3-month supplies are less money, which I guess, you buy in bulk, things are less, but some plans don't even offer that. Look, I understand that prices can change, and sometimes you don't know what the price is. If you're in a car crash and you break 5 bones, you probably broke them differently than anyone's broken all 5 of those bones like the same way. That hospital will do something different, right? I understand that charge not coming until the end, but I am going to be taking this insulin and using these CGMs and tech the entire year. You can tell me the price, okay? Okay, now for some positivity. I have found that there are coupons and discounts available for diabetes technology, and probably a lot of other companies as well give these out for people who are having problems with the pricing. So, for example, I found that Freestyle Libre CGMs, they have a program that limits the price you pay out of pocket to $75 a month with their coupon as long as you have insurance. That is why I made that call today and I found out I don't have insurance. Anyway, Omnipod also works with people to give financial services and help. Their system gives, I believe, limit or reduces the price paid out of pocket by $100. That is on the price when you buy them, like full price, not going through insurance. I'm glad that these systems at least are built for people who get into this situation and aren't as well connected as I am, because this is the other thing. You guys looked out for me. The diabetes community was there for me. I had an outpouring of messages saying, hey, Justin, can I send you pods? Do you need CGMs? Do you need insulin? Blah, 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 blah. And for a couple of you, I did accept pods. And I'm so thankful to you for doing that, because I was freaking out. I had 15 days left of pods when this all happened. And I had to pay $2,500 for pods. Like, thank you. And thank you to the people who have reached out saying, can I help you with discount codes from Abbott and Omnipod? Can I help you find the best insurance? Like, y'all are amazing. And it has inspired me to want to see if I can make change. What can I do here? Can I go to Capitol Hill? Can I advocate for people with diabetes? Can I start to lobby, like good lobbying? Does that exist? Can I lobby for transparent pricing and making health insurance just a little bit more simple for people? Because the amount of stress and hours that I've put in, that's lost hours in the workforce. I put in at least 40 hours. That is a work week of time that the economy lost because I was trying to figure out the health insurance system. And I also think that all these departments I'm going through, all these middlemen, I think there's a lot of wasted money here that we can use to maybe, make things less expensive, maybe? Outside of advocacy, I want to do some work here. On my podcast, I want to bring some people on to talk about the health insurance system, why it is so convoluted and how it's evolved over time, what people with diabetes should look for and how they should choose their health insurance. Like anything that I can learn from what I did, that I want to talk about, but I also want to do a whole episode or maybe even series on people's experiences. And that's why I want you to comment with your horror stories. This is a crazy system, but you're not crazy for thinking it's crazy. You're not alone. We're all in this together. Drop your tips and your stories in the comments. I'll be posting another part 2 on social media of where I come out in all of this. But yeah, thank you to all the supporters out there that sent me messages and offered to send me supplies. You're all amazing, and I'm going to give back here by talking about this more, getting people on here to help us all learn. And I'm going over to Capitol Hill. I'm gonna see what I can do. Politicians, anyone, a politician, anyone, anyway, DM me on Instagram. It's usually the best way to do it.
And don't forget, check out that podcast episode where I dove into the problems of the US healthcare industry with an expert. The link to that is in the show notes. We dive into all of the problems there are now, why insurance companies are making record profits, and what the future of insurance looks like with AI.
Anyway, I hope you enjoyed the video, or I hope I didn't make you too angry, and I hope I wasn't too angry. Subscribe to this channel if you want to see like other fun, positive videos about diabetes tech, news, and management. This wasn't one of those. And give this video a like if you enjoyed it, or if you're angry and you want to see some of that content I talked about. All right, I'm Justin, and I'll take you later, and I'll be much more positive next time.